Okay, welcome everybody to the December 9th Sacramento County Public Health Media Briefing. We will hear from Dr. Kasirier, Jamie White, and Rachel Allen today, and you guys all have a chance to ask your questions. As a reminder, today's briefing will be the only media availability today and tomorrow for Sacramento County Public Health staff, unless something crazy happens. So please bring your questions after the briefing. And as we did last week, as soon as we're finished up with the English question and answer session, we will go straight into a Spanish language answer session for those of you that use Spanish language content. So I will go ahead and hand it over to Dr. Kasirier.
Good morning, everyone. And just a reminder, we're still getting some background noise. So could you please remember to mute your phone? Make sure that everyone is able to hear clearly. So thank you again for joining us. Just an update on the numbers. We have 165,141 cases of COVID-19 reported, and this data is from yesterday. We haven't gotten the update from today. We're averaging about 200 cases per day, and our case rate, daily case rate is at 14.1 per 100,000. You probably have noted that we are seeing an uptick in numbers, and from anecdotal information from our community testing sites, we gather that this is due to people traveling or gathering during the Thanksgiving holidays. So we are going to continue monitoring that. Our deaths are 2,467, and we're averaging about 3 deaths being reported every day. From our update last week, the last update that we gave, we did note that our public health lab has started doing whole genome sequencing, and there are a number of follow-up questions that I just wanted to update you on. The capacity for the Sacramento County lab is 40 samples per week. So we still have to prioritize which samples we are going to test. And it usually takes about 5 business days from start to finish. That's the shortest period of time, but usually actually averages between 2 to 4 weeks to get complete results. I also wanted to note, yesterday we were reminded of just how long this response has taken. Yesterday marked our 100th week of the public health response for COVID-19. So kind of a somber reminder of how far we've come and also how far we still need to go. So with that, I'm going to turn it over to Jamie White to talk more about the sewage surveillance.
Yes, so a group of researchers led by Stanford University Civil and Environmental Engineering professor Alexandria Bohm began developing methods to monitor wastewater in several areas of California for SARS-CoV-2, which is the virus that causes COVID-19 infection back in 2020. Wastewater is a robust source of COVID-19 because infected people shed the virus in their stool. Researchers developed the use of laboratory tests called assays to identify genetic markers for variants of the SARS-CoV-2 virus. They primarily use settled solid samples in wastewater to detect pieces of RNA from the virus. Wastewater surveillance, especially when combined with genetic sequencing from clinical specimens, can be an accurate method of identifying and tracking changes in community trends of COVID-19 infections. The Stanford Wastewater Surveillance Group started collecting samples at Sacramento wastewater treatment facilities on December 8th of 2020. So yesterday marked their 1-year anniversary of collecting samples locally. One of our epidemiologists, Felix Tran, was designated as a primary point of contact for public health and began meeting with the Stanford group to look at the data with them in April of 2021. Last Friday, the Stanford group notified Sacramento County Public Health of a genetic mutation called HV69-70 from samples collected during the last week of November. This specific mutation is present in the Omicron variant. It was also present in the Alpha variant, but Alpha has been essentially extinct locally. And then on Monday of this week, the Stanford group notified public health that the samples were also positive for another assay that targets a deletion specific to Omicron, confirming its presence. This is the first time that wastewater surveillance has alerted us to a new variant of concern circulating locally before whole genome sequencing of clinical specimens has alerted us. To date, we have not been notified of any clinical cases of Omicron from sequencing, but not all specimens are sequenced. So they probably exist. We just haven't gotten one yet. For example, Delta was first detected in clinical specimens, and that was prior to the Stanford group developing an assay to detect them in wastewater. And that is all. I will pass it back to Janna.
Go ahead, Rachel.
Hi, good morning. So news this morning that the FDA has authorized boosters for youth who are 16 and 17-year-olds. And of course, this is only for Pfizer. Moderna and J&J are not approved for anyone under 18. And this is on the heels of some data really showing that boosters may be critical, controlling the Omicron variant. And so just want to emphasize again how important it is to protect this population, our 12 to 17-year-old population, not just with their first and second doses, but to consider boosters as well, not just for their own health, but we want to protect their families and those they come into contact with, keep them in school and allow them to continue to play sports and participate in activities. So millions of doses have been safely administered to children in this age group. The risks of COVID illness far outweigh the risks of vaccines. These vaccines are very safe. So just reminding and encouraging families to take advantage of getting out and getting vaccinated, whether you have young children, whether you have youth. We have clinics continuing to happen all over the county, and keeping in mind that the holiday season is coming, and now is a really good time. We're just a couple weeks out from Christmas, and it does take a few weeks to develop immunity. So CDPH continues to take the lead with some school located vaccine clinics that are occurring throughout the county, as well as some of our partners, and our own team is also doing some efforts within the schools. We do also support all of those efforts that are going on with vaccine redistribution from our own supply. So again, encouraging families to go out and seek an opportunity to get your children and yourselves vaccinated before the holiday. And you can check in with your own medical provider. Pharmacies are offering appointments. You can look on My Turn. And then our county website also has information about the pop-ups that we offer each week. And we do see children 5 and over all the way through adulthood at our pop-up. So we would be happy to see families come out and join us there as well. Thank you.
Okay, so that is our update. We'll go ahead and open it up to question and answers. Please raise your hand or throw a question in the chat, and we'll go ahead and start taking questions. Michael, go ahead.
Hi, this is Mike Kinsecki. Dr. Kasiria mentioned the increase we've seen since Thanksgiving, which was 2 weeks ago today. Is it sort of in line with what we were expecting to see? Is it steeper, less steep than what we might expect related to holiday? And a related question, have there been any outbreaks or case clusters linked to schools as students might return from Thanksgiving break last week?
I'll start off and then hand it over to Nick to answer about the question about the schools. So we were concerned about seeing an uptick in numbers as a result of the Thanksgiving because of the number of people that were traveling, and also knowing that this is a popular period of time for people to gather, families to get together. So we tried to get messages out and hoping that people would take the precautionary measures and reduce or minimize the increase as much as possible. It's hard to gauge just how much of an increase was expected. We did expect that there would be some, but we feel that because this time around, we do have vaccinations available, that it's not going to go as high as it did last year. But of course, we also need to remember that there's still a large percentage of people that are not vaccinated. So we need to continue our efforts for vaccination, as well as also the other measures such as making sure that we use masks indoors, because those are all measures that help to keep us safe. So I'll turn it over to Nick for the schools.
Yeah, we continue to see a small number of isolated outbreaks in some of the schools. I can share anecdotally that in conversations with our school partners, some of them did report, a decent number of cases where folks were reporting testing positive over the break, but they did not return to school. So there was not the same level of contact tracing needed in those cases, because you didn't have on-campus close contacts or exposures that you would have under normal circumstances. So, I think as expected, with folks gathering, we did see that, but not having to do the same level of contact tracing in those cases.
Do we have any other questions? Dylan?
Thank you. I have a question about vaccinations among teenagers in the area. Last I checked, Sacramento was still pretty far behind the state rate in getting those between 12 and 17 vaccinated. I think it was something like 36% in that age group were still unvaccinated, while the statewide wide rate was around 30%. I'm just wondering, what are some of the reasons why the county has fallen so far behind the other areas of the state in this age group, and probably multiple factors. And then what are some of the ways the county is trying to fix or improve these teen vaccination numbers? Thank you.
Sure. So, I mean, I don't think we can exactly pinpoint the reason why, but, we're continuing the efforts to just get vaccine in as many providers' hands as possible. We're onboarding new providers continuously and making sure that they have the vaccine available. And I think we just have to continue the message, and we're working with schools and other, community resources and trusted messengers that the vaccines are safe. Billions of doses have been given worldwide. Millions of doses have been given to this age group, the 12 to 17, with very little side effects. Anything concerning really. We're mostly just see the normal things you see with vaccines, and really encouraging families. This is another vaccine, just like the other ones that you've given your children to protect them against serious disease and illness. This one is added to the list, and it's really important. And so I think we're just continuing to, create more opportunities and to get out with that message that this vaccine is safe and that it's really important for this age group, just like it is for others.
Maricela?
Good morning, Maricela de la Cruz with KCRA. I'm going to ask this question, and after it's answered in English, can someone also answer it in Spanish? So is there any concern about myocarditis among teen boys and young men? And how severe is that side effect?
Marcel, I'll just jump in really quick. We're going to have our Spanish language briefing right after this one. So if you can stick around, then Victor can provide you answers to questions in Spanish.
Rachel, did you want to start with that? Or?
Yeah, I think, the risk of myocarditis is very low. It's also self-limiting and a treatable condition, but the risk of heart issues following COVID are far more significant. And that's, I think, the message. So I believe the cases of myocarditis have been very, very small and treatable.
Janelle?
Hi, Janelle with Cap Radio. So I just had a couple questions. So I was wondering, does the county anticipate making any changes to the current guidelines or protocols in light of Omicron? And how much of a concern is Omicron to the county right now compared to, the Delta variant or other variants that have appeared in the area?
There's a lot we still are yet to learn about the Omicron variant. We do know that it seems like it does spread pretty quickly, but we still are waiting for data. I believe that there are studies that are being done to gauge the severity of illness. So far, the reports that we have from South Africa, initial reports indicate that most people have had mild disease. But we still have to continue to monitor that. And there are also still studies that are being done about the effectiveness of the vaccines. So I think those are answers that we'll get pretty shortly. And as far as protocols, we do not anticipate changing any of our protocols now. I think it's important to note that the Delta variant is still the predominant variant in Sacramento County. We know that the vaccines that we have are very effective. So we are going to continue pushing for vaccination for our communities. And while we're still trying to get to that, we still need to remember to use our masks and especially indoors.
Thank you.
iHeartMedia.
Hi, this is Nika from iHeartMedia. How many times has the Omicron variant been detected in the wastewater? And if it's multiple times, is that of concern?
I don't know if I have an exact number. I know that they were specifically looking at 3 different samples. I can get back to you with the exact amount of time, but I know that last week was the first time that they've detected it in the wastewater.
Okay, do we have any other questions for our English Q&A? As a reminder, I will send out the link to this entire recording for use. And if we don't have any other questions, then anyone that is not in need of Spanish language content can drop off, and we will continue on with our Spanish language Q&A. Going once, going twice. Okay, this concludes our English language version, and we will continue on with our Spanish language. Thank you for joining us if you're dropping off. Okay. So Maricela, do you want to go first and re-ask your question for answer in Spanish?
Ya. ¿Existe alguna preocupación sobre, no sé cómo pronunciar myocarditis en español, entre jóvenes y hombres jóvenes y qué tan severos serían estos efectos?
Sí, la preocupación es muy mínima debido a que es una enfermedad que es tratable. Por la mayoría de los casos no es algo que va a impactar la salud a un nivel extenso, causar la muerte o algo tan grave como lo es el COVID-19. Entonces, los problemas y el impacto que tiene el virus del COVID-19 es mayor comparado con estos casos mínimos de esta enfermedad.
Sorry, Andrea, go ahead.
Hola, tengo 2 preguntas, están relacionadas, voy a hacer las 2. Como se estaba hablando, hubo un aumento el Día de Acción de Gracias en casos, ahora se aproximan Navidad y Año Nuevo, que por cierto son 2 holidays que son bastante celebrados por los latinos. Es posible que suban los números como subieron en Acción de Gracias por estas 2 festividades. Se sabe que a nivel estatal hay falta de trabajadores de salud. ¿Cómo se está preparando el condado para un aumento de casos en enero? Y la segunda pregunta, que está relacionada con la llegada de Omicron, también se esperan que se hagan medidas más estrictas de las que están, me refiero a las medidas de protección actuales, se espera que se pongan más estrictas ahora que se detectó Omicron aquí en el condado.
Comenzando con tu primer pregunta, sí, se vio un incremento de casos después de los días festivos del Día de Acción de Gracias. Se cree que es debido a las reuniones familiares que vinieron fuera de la ciudad, personas fuera del grupo, del círculo social que regularmente las familias se reúnen. Entonces, la recomendación es la misma que hemos tratado de fomentar día a día, semana con semana, de la importancia de vacunarse, recibir la primera, segunda dosis y la vacuna de refuerzo para las personas que la necesitan o que califican. Entonces, eso es lo primordial. En cuanto al personal dentro del condado, se sigue trabajando con el número de gente que tenemos, se sigue contratando personas para tener la disponibilidad de recibir a las personas y que reciban su dosis. Pero lo más importante es que la comunidad se acerque a esos centros comunitarios para recibir su vacuna. ¿Me puede repetir la segunda pregunta?
Sí, se espera que con la llegada de Omicron se pongan más estrictas las medidas de protección actuales.
Por el momento no hay reglamentos ni pláticas aún a ese nivel, pero mientras se sigue observando cómo van creciendo los casos, si crecen los casos, no hay en sí casos específicos, simplemente la identificación de este virus en esas muestras. Estaremos al tanto de qué pasos se podrían seguir para proteger la salud de la comunidad, pero por el momento no hay nada específico en ese aspecto.
Okay, Susanna, do you have anything?
Yeah, when it, well, sorry, in Spanish. Víctor, no sé si nos puedes platicar un poquito sobre la detección de Omicron en el condado. Obviamente no por medio de una prueba, sino por muestras en el agua del condado. ¿Cómo es que eso funcionó y cómo se detectó?
Yo creo que es algo que le dejaría más a un experto de química y ciencia. En específico, yo no te podría explicar eso, pero te tengo el contacto para que pueda darte esa información.
Ok, y la segunda es obviamente con esto de la aprobación de la vacuna de refuerzo para los jóvenes de 16 y 17 años, el condado planea expandir o pues expandir sus clínicas o van a actualizar esa información para que pues personas puedan hacer citas para estos jóvenes.
Las clínicas que tenemos son las que tenemos disponibles, o sea, continúan siendo las mismas. No se espera que tengan que se terminen las dosis, que falten dosis para distribuir. Lo único que seguimos fomentando es la importancia de acudir a las clínicas comunitarias, a los centros de salud y a su médico de cabecera para pedir esta dosis de refuerzo. En este caso, para los adolescentes que ahora que ahora califican para recibir esta vacuna. Entonces, lo importante es que las personas y las familias reaccionen y vayan y reciban esta vacuna. El condado tiene los recursos para ofrecerlos. Lo que les invitamos es que acudan y respondan, hagan su cita y reciban su dosis de refuerzo.
La última que tenía sobre las pruebas de vacunación, pruebas de COVID. Hemos recibido como preguntas sobre dónde pueden ir y encontrar una página o donde se hagan las pruebas gratis, porque nos han dicho que en ciertos lugares les cobran, no sé dónde exactamente, pero dónde pueden ir para ver dónde se están ofreciendo las pruebas de COVID gratis.
Yo creo que depende de cuál es la situación. En caso de que es una persona que necesite una prueba dentro de 24 horas o el mismo día, hay ciertos lugares que va a tener un costo para hacer estas pruebas. Yo creo que depende del caso de cada persona. Si están a punto de viajar, lo importante es darse el tiempo necesario para hacerse las pruebas y recibir sus resultados de acuerdo a que les dé tiempo de hacer su viaje. Entonces yo creo que depende cuál es la situación, porque la mayoría de las clínicas que ofrecen las pruebas de COVID, las que tenemos listadas dentro de la página del condado, son gratuitas, pero todo depende de cómo se organice el tiempo para antes de hacer su viaje.
Ok, gracias.
Okay. Do we have any other questions? Maricela, at one point you had your hand back up. Do you have any other questions?
No, I was going to ask the same thing Susana asked about Omicron. Victor, if you could forward also that contact information for that question in Spanish.
Yes, I have a county website link that you guys can get that info for sure.
Okay, any other questions? Or are we all good here? Okay, thank you guys for joining us. I will send out the link to the full video, which will be the English and Spanish language briefing. And thank you for joining us.